Hello everyone, can you hear me okay? Yes? So as Karen said, I'm Hannah and I'm the Children's Inherited White Matter Disorders Nurse Specialist for Leeds and Manchester. So I look after lots of families in the north of England. And Karen, thank you for asking us to talk. We're nurses, so we don't normally do this sort of thing, so please bear with us. It won't be very medical at all. It's just about how we can support you out in the community. I'll let Anna introduce herself.
I'm Anna. I'm the clinical nurse specialist in inherited white matter disorders at UCLH for adults. And I'm also a senior research nurse in inherited white matter disorders, so I combine both roles. Thank you so much for having us today and letting us talk.
So myself and Anna work very differently in adults and children, but the generic definition really of the nurse specialist is to ensure that children, young people and adults who have a leukodystrophy and their families receive a high level of evidence-based care. And that's done now through having the highly specialised service, which means that individuals and families can have access to evidence-based practice and expert knowledge. And we recognise that every family is different and every care pathway will look different for that family. And it's really important that we recognise that everybody wants individualised care, and that's what we offer. From that first referral, we'll support families via clinics, phone calls, and follow up any concerns or questions, which then allows us to liaise with local teams out in the community.
So on the clinic letters, you'll probably find the CNS contact, or after clinic, probably your consultant will give our contact. And this is because we are the main point of contact for families and patients in between clinics in case you need any further information or you have any concerns about your care. We also work closely with the IWMD consultants and the local teams to help the patients and families navigate the broader healthcare system. And yeah, so I think next Hannah is going to talk about her role in the children's side.
Yes. So we're really proud of the work we do within the children's service. The care we give is very much guided by the family. I'm here for when things get tricky, when you're struggling with little things at home, or when things are going well. Equally, we like to know about that too. The care is very individualised, so it's different for each family and each patient. I can attend local clinic appointments, so lots of family feedback to me that they really struggle out in the community seeing sort of local teams who often don't know what the condition is, or I haven't even heard of it before. So sometimes they find that it's nice if I can go and sort of support them in their local clinics and just be there as sort of support and a little bit of education really as well. Leading on to that, I can go into schools to explain what condition the child has and also support with EHCPs, review meetings, answer questions and concerns, regular phone calls and face-to-face reviews, and I can do home visits if that's easier for families. If they're having a particularly tough time, sometimes it's really valuable for me to go out and see what's going on at home and how it is actually, how this condition is affecting them in their day-to-day life. And liaising with families before and after clinics. I ring families before clinic and then afterwards just to answer any questions that families may have. And often we can't predict the future, which is really, really hard for families, and often as new symptoms and new worries come along, that's where families seem to struggle out in that community. So we can offer that service of linking with different teams, supporting when things get a little bit tricky, and we are fortunate to have a psychologist. The wait is a long time to see the psychologist, but we can refer as needed, and that's not for everybody, but with your consent we can refer if psychology is feel like it's needed.
So for me, the role of the adult clinical nurse specialist is divided in four main aspects. The first one, and most obvious one, is the clinical support. Supporting patients from even before the diagnosis is essential in this role, especially as many of these patients may have never heard of these conditions when they get diagnosed. So I think it's particularly important for us to manage the expectations of the families and the patients, and to support them throughout their and inform any decisions about the treatment choices and the lifestyle adjustments that they will face. As a clinical nurse specialist, I will also be arranging and consenting patients for genetic testing. This type of testing can be quite difficult, and it's important that we overweigh the risks and benefits of receiving a difficult result. So, for example, I will be explaining that we might not find the answer that we're looking for, that we might find something unexpected, or that we might find something that we are yet not able to understand. These are part of the counseling that we give during the consent process. Due to the neurodegenerative nature of these diseases, advanced care planning should be at the focus of our practice. Therefore, conversations about long-term care planning should start as soon as possible. These conversations, I understand they can be very sensitive, especially at the start, but they will ensure that the voice and wishes of the patient are carried throughout their journey, and they will avoid loads of stressful family situations, and it will just avoid unnecessary stress for the patient. Another important aspect is symptom management. Although these diseases are rare, their symptoms aren't, and they're generally quite similar to the ones that we see in other neurologic conditions. So I will try my best to also help recognizing these symptoms and linking patients to the right resources and services. Sometimes it's just as simple as explaining what their services are. For example, I once had a patient that was struggling with swallowing, and she had been referred to a speech and language therapist, but she said that she had declined it because she thought that it was only for speech problems, and she didn't have any of those. We can also follow up on certain medications. For example, the doses can be adjusted depending on the patient's symptoms, and we can advise on that during a phone call and during the nursing clinic. Just go to the next slide. So in my case, I'm also a research nurse. So this gives me the great opportunity of giving a more holistic care to the patients. And this way, I can keep my patients informed about the latest developments and clinical trials, the patients I see in clinic, but also I can help with the care management to those patients that I have on my clinical trials. On this role, we can also support smaller projects, smaller academic projects to help develop the knowledge of these rare diseases, for example, by applying and analyzing patient questionnaires. Last but not least, we can also support with social and community. So we will try our best to link you with amazing charities like Alex TLC, which do a great work. And we can also, like Hannah said before, we can also write letters or educate professionals in the community that might have not heard of these conditions before by explaining what special requirements this group of patients may have. I think we're now going to talk about what are the future plans. So if you want to start with yours.
This service for Leeds and Manchester Nursing Service is relatively new, and we've done quite a lot in that short time. But we do have lots of plans for the future and moving forward in a way that can benefit patients and families. We'd like to do more fundraising events with Alex TLC, raise money, and we always signpost our families to Alex TLC, and they just always say how fantastic you all are, so they're so lucky to have you. And we'd like to do some more leaflets explaining conditions in an easy to understand way, where they can take that to family members as well, because sometimes the feedback we get is that they don't know how to even explain it to families, how to even start doing that is so tricky. So if we had a leaflet with it written down in a really easy to understand way, we could go through that with family and friends as well. We'd like to create some standard operating practices and protocols so that everything we're doing is streamlined across the whole of the White Matter service in the UK. And ultimately, our aim is to develop a person-centred nursing service which is standardised so that every single centre is doing the same thing, which is going to be a meaningful service for all of you families. In Leeds and Manchester, we're just trialling the patient passports at the minute, which is a document. It's quite short, but it's individualised to each child, and it explains a little bit about what that condition is and how it affects that child, what the symptoms are, how it affects feeding, how it affects day-to-day living, what a good day looks like, but also what a bad day looks like. And we have worked with Karen with that. And the hope really is that that's a document you can take out and show local doctors, physios, anybody that's out in the community. And that means that we can sort of bridge that gap from the White Matter service into the community as well, because I feel that that is an area that families often need a lot of support in, really. So we're trialling that at the minute, so hopefully we'll get those rolled out very shortly. So yeah, that's the plans for me.
So I would like to focus my future plans in developing an advanced care planning that is more tailored to patients with inherited white matter disorders, and that can be shared and discussed during nursing clinics. I think it will also be important, just like Hannah said, to work on information leaflets and educational clinics for newly diagnosed patients, so that these patients can have their own time and pace in understanding the very newly terms and all the information that they receive. We also want to continue growing and giving specialized care and genetic testing remotely through the telephone clinic, which we are currently doing, but we want to keep expanding on that. Just because I think this is especially important so that we can reach all the patients that can come to us. And lastly, we would like to establish family tree trackers, which will help us identify and monitor individuals at risk, and will give us more information about the inheritance patterns, and will ensure early intervention. Thank you.
Thank you.
Thank you both so much. That was such a good presentation.
Thank
They were
you.
both